So, Michael Knight, welcome.
Good morning. Great to be here.
Thanks for joining us. So you're Chief Information Security Officer at South East London ICS. For those listening that may not know what that role really entails, what does that mean and why is it important to the people of London?
So, brand new role for South East London. So started last July, and really it's about leadership across the system and kind of delivery of our cybersecurity strategy, making sure ultimately we're kind of protecting services and also kind of protecting patients' data. I think the big thing for me that I've really learned coming into this role is the real complexity and breadth of contributions from organisations. So this is not just about how do we support the big hospitals, the big community providers and kind of your primary care. The system is so much more diverse than that. So really having that system-wide leadership, and I think is, I believe, as I would, really valuable and something that I'm really enjoying.
Thank you. That's a good opening gambit. So it sounds like a complex ecosystem. I mean, how many organisations sit within the ICS?
So there's lots of organisations doing great work. We've got kind of hundreds of voluntary organisations involved. We've got the best part of 200 GP practices, as well as a number of hospitals, hospices, community providers, mental health providers, and lots of GP federations doing great work. So it's vast and really, really interesting. Certainly, as we've been looking at kind of some of the supply chain type work and some of the kind of the way that we commission services and who we're commissioning services from, it's really interesting, and particularly for South East London as a system that is really focused on how do we delegate as much of the activity to kind of that really hyper local delivery model. So very much about delivering at place and kind of really exciting to see kind of integrated neighbourhood teams coming down the line. So that it would probably be, on balance, having fewer organisations involved would kind of certainly give me less work, but I do appreciate the kind of the benefits of that clinically, operationally. But of course, the more organisations delivering care, that spread of risk is across many different organisations. So there's a lot going on.
It sounds like it, because a couple of years ago we had the STPs. Now we've transitioned to ICSs and ICBs, and there's a whole push around integrated care and, joining the boundaries across the system and place, as you describe. Is it working in the way that we expected it to? What are the challenges around the ICS and the system as a whole, do you think?
Certainly since I've been in South East London, I've really felt the support of partner organisations and that collaboration. So I kind of still always refer when I talk to kind of colleagues in the organisation, that the ICB is that coordinating kind of body. It's still a young organisation. There are still things that we are going to be working out. And now certainly many of the ICBs have kind of been through a really challenging period with the cost reduction activity. So you kind of, those organisations have kind of landed into trying to form a new organisation, then going through a reorganisation and still kind of keeping that collaboration going at system level. So I think it's, my view is it's still early days. We need to make sure that we're kind of we give this change time to embed. We give people the opportunity to build those relationships, build that trust, and really kind of collaborate and work together to look at how do we do the best for people in South East London.
Absolutely, well said. So let's bring it back to you, because that's why we're here today. You started as a IT help desk analyst, and you've gone above and beyond, and now you're CISO at Cell. Tell us about the journey. How did that happen?
It kind of, I don't know if it started half by accident, or there was certainly some intent there. So I was doing online support for a telecoms company, and I had full-time permanent role near home, was quite kind of settled, and this opportunity kind of came up, and I just thought, I'm going to go for it. It was a bit of a commute. And it was only fixed term. So I just thought, you know what, I'll go and do the interview. I'll see what it's like. And now I remember asking the question around, it's a 12-month contract. There's a bit of a risk for me. I've got
this was for sale.
No, this was for this is my first role right at the beginning. Right. And it was that kind of that question of, is this just going to be for 12 months? Because I've got bills to pay. Yeah. And I remember a guy called David Williams, fantastic. He said, look, I'm on a fixed term contract and I'm determined to make this work. And there was just something about that feeling that he gave me that I kind of trusted him. Right. And I went for it, and it's been fantastic. I think once you get immersed in the world of digital health, I think you kind of go one or two ways. You love it and you're stuck here forever, or you kind of go, maybe it's not for me, and I'll kind of head off elsewhere. But really pleased that I've kind of I've stayed in digital health, really enjoyed it, and certainly had lots of challenging roles along the way. So I worked nationally at what then became NHS Digital, was now NHS England, but also working kind of much more recently with integrated kind of care systems in kind of London and the South. So yeah, it's been really interesting kind of going on that journey into increasingly technical roles, but probably not coming from that engineering background. So that's always a really interesting kind of, I guess, paradox for me in terms of that kind of being seen to be a very technical leader, but not always really feeling like one.
Imposter syndrome to a certain degree.
Yeah, certainly. I think, I think it's healthy to kind of have those doubts and to think about where can I be better. But also as a leader, it's important not to think about too much about the things that you can't do. Really trying to lean into your strengths is also key. And I'd probably say that I'm a jack of all trades and master of none. There's lots of different things that I can do to a reasonable level. And so, try not to get too bogged down in trying to be an expert on everything, because I think actually the breadth that you can bring to your team if you've got experience in many different areas is really helpful. That's what really kind of supports people to progress, develop kind of under your leadership.
Yeah, I mean, it's the power of the team, isn't it, right? Everybody plays a role. I think we talked about it before we started today. You sound like you're kind of in a playmaker role where, you respect and understand who does what and who brings what to the table. And like we said, there's no I in team, is there? So sounds like a, great leadership approach to me. Going back, it's interesting what you said around kind of the journey from IT support. I mean, our work in London, we tend to see, like you said, people kind of rise through the ranks from the project side of organisations, and equally lots of people have their degree in computer science or engineering, but you don't often see people come from, support up through technical roles into something as kind of advanced as a CISO role. So you must be doing something right.
I mean, certainly really, really proud of that experience, and I've certainly, where kind of times have been challenging, been quite kind of happy to don the headset for a period. Those things where you're kind of, I certainly remember periods where we've kind of gone into the Christmas break, and we've wanted to make sure that people can go out and kind of have some kind of time together, have a little bit of kind of time for the team, and kind of been quite happy to don the headset in those times. But actually, that's for me that real frontline engagement with people is where, as a leader, you learn the most. You learn about the real day-to-day experience that the colleagues that we're here to work with experience, and I'm really passionate about user-centered design and putting the needs of users very much at the forefront of what we're trying to do, and trying to make sure we are not designing for ourselves as technologists or program delivery teams.
Yeah. So on that note then, tell us about some of the kind of key focus areas for you or South East London and its stakeholder group over this year, coming year.
So think from a cybersecurity perspective, really, really sharp focus in terms of getting a deep understanding of the breadth of the services that we offer and what that means for us from a cybersecurity perspective. Yeah. As I said, it's a really complex system, and like every other part of health and care, there are finite resources. I can't afford to boil the ocean. So really, really sharp focus on prioritization, but also that really sharp focus on how do we work together with clinical operational colleagues to think about the impact side of that risk scenario. So I think in cyber, we spend a huge amount of time thinking about the technology and how do we reduce the likelihood. But actually, we also need to be thinking about that impact side, make sure we understand it, make sure we prioritize the right things, make sure we have the right plans, but also bring back in some of those technical opportunities that we might have to mitigate the risk, particularly in response. So that's clearly a really key area. I'm really hoping over the next month we'll have our cyber strategy approved by the board. So that's been fantastic work from across the team. I've been really well supported on that. So really, really trying to pick up and get going on that. A very early priority for me is about establishing board visibility of key metrics and having that, having the ability to kind of effectively go from, okay, well, what does all of this mean from a risk perspective? So if we want to hit our risk appetite, our metric should look like something like this.
Okay.
And being able to then go, right, okay, well, so now if you want your risk appetite to be at a 9 around information management, then actually these metrics should be here. And then having that kind of quite disciplined approach to working through the right, okay, well, how do we get to where we want to get to? What is it that we need in terms of support to get there? So that's a really early priority. I'm hoping to get that up and running by the end of spring. And I think once you then establish that visibility, particularly at system level, system working is about working together. But folks are also really proud, quite rightly, of their own organisations. So I know put leaning into that kind of pride in the work that we do in teams, and maybe even a little bit of a kind of competitive edge, maybe in terms of really kind of focusing on those key metrics that reduce our risk. So that's probably the other one that's a real area of focus. Of course, supply chain would be something that I probably would be remiss of me not to mention here. Particularly some of the kind of things that we've had happen in South East London over the past 12 months as well. So really about getting the strategy in, getting people working together, understanding the impact, getting visibility of where we're at and where we need to be, and kind of really getting stuck into the supply chain to make sure that we know and understand how all of those things kind of fit together, which feels like quite a daunting task when you say it like that.
That's a huge amount of things that you need to get through. Yeah, I'm trying to think. Had a couple of points I wanted to pick up on. Interesting what you said about KPIs or metrics that you could kind of communicate to the board. Could we drill into that a little bit more without kind of breaking confidence?
Sure.
Is that something that's kind of easily digestible, things that the board can recognise as kind of non-technical experts, but that also trickles down, that kind of operational folk can manage and improve on?
Yeah, I think it's one of the real challenges trying to work at system level is getting consistency in those metrics, because everybody is using there are different tools that are being used in different organisations. So we have had to lean into the things that are kind of that we all have. So particularly the tools that are available to us via NHS England, either as part of large national agreements that we're all part of, or the kind of some of the services that they offer. So we're really leaning into those, and actually some of those it's quite helpful to be able to have a broader conversation around, right, okay, well, let's talk about where we're at in terms of South East London, but also where is South East London at in London, and where is South East London at nationally, and really kind of getting that picture of, so where are we compared to is quite simplistic, but really helps to frame, well, are we ahead, are we behind, are we average, like what does that mean? So we're not where we want to be, I think is probably fair, and I think there's been some really fantastic work that I've seen happening as we've kind of, I think our cyber leadership group has worked very closely together on what those key things should be, and I think once you have that kind of that view of, right, okay, well, this is what's going to be key and important and visible. I think naturally kind of human nature is it gives you that focus in those areas, because you know you may well get the question down the line, and you want to be able to say that you're in the best position. So I think that's certainly there's work to do. There's been some great early work, some really good quick wins. I think the challenge always with cyber is the world moves, so you can do something today, and then within a month it's all changed. The numbers have moved, and you need to go again. So that's a real challenge, and I think certainly that kind of that system coordination aspect that kind of I'm doing in my role and trying to provide that visibility kind of helps us to make sure that we maintain that focus and we maintain that commitment.
Yeah, I do kind of like there was maybe 6 months or so ago, I know there was a bit of a clickbaity news article around the centre or government, publishing the performance of NHS FTs up and down the country, and lots of people were kind of in uproar saying, oh, you can't highlight the people doing the bad. But I kind of like the approach, to be honest, of kind of looking at peers, and there's a knowledge share and I think it drives people to improve to a degree. Would you agree with that?
Yeah, I'd probably say it's not binary. I think there's a balance to find. Yeah. So I think what I would say is that when certainly one of the key things I've learned coming into a new role has been every organisation has slightly different challenges.
Absolutely.
So it's we can't go and look at an organisation that's got that's really complex in terms of the services it's delivered. It's got loads of staff, and it's just been for a merger, for example. Comparing that to an organisation that's got a smaller number of services, with fewer sites operating out of, fewer staff. I know there's a real challenge there in terms of they're kind of not comparable.
Yeah,
those two organisations would have challenges, but they would be different challenges. So it's really, for me, what I am going to be focused on is making sure we don't lose the context as we go through that process. Because the numbers can help tell a story, but I think my role is to bring in the kind of the realities of that story. And I think a lot of this, particularly in digital, there's always a huge demand on our teams to come and deliver something new. I think sometimes we particularly at kind of portfolio level, when we look across all of those pieces of work, I think sometimes organisations really struggle to kind of articulate those trade-offs that we are making, and those kind of unintended consequences that you might face as a result. So organisations doing a really big EPR rollout in a particular year, we can expect there to not be a bit of a drop-off in other areas and other things. So we clearly want to make sure we mitigate those things, but we also have to be realistic around, okay, well, what level of commitment is going into the key priorities, and just being watchful of the kind of the compromises and the unintended consequences as they arise.
You mean in terms of if you're delivering a huge scale implementation like an EPR, that other programs don't get the attention that they need? Is that?
I think I'd probably be a bit far to say the attention they need, but I think certainly there is always that desire to, as you're going through that really big change, to make sure that other things are continuing to move along. So I remember being involved in an organisation doing an EPR rollout, and there were a number of other pieces of work that we were still trying to make sure happened as we were kind of moving through, and particularly that trade-off, I guess, between the needs of an individual organisation and the needs of the system as well. And that's a really really interesting challenge. So I think the systems that the ITSs that get that right is where you have that proper senior leadership from a digital perspective that are bringing that together and just making sure we kind of we have those awkward conversations where we go, right, okay, well, we've got the real focus on this, and actually getting everybody behind that. So I was really impressed when I came into South East London to kind of hear about how everybody had kind of come together around the work for the Epic go live over the past kind of year or two. So yeah, and you need that system leadership to make that stuff really come together. Yeah, absolutely.
So in terms of the strategy then, just help me understand, because setting a strategy at a system level, there's leadership from the centre that you guys, I'm assuming, are kind of taking the the good stuff from there, but then there's also at a local level, people have their own strategies. How do they all marry up?
Yeah, so I think certainly both in terms of our digital strategy and in terms of the cyber strategy, no, it's not a system strategy that's designed to be there to take away the ability to prioritise the things locally that you need. So clearly what we'd like to see is that we have very much complementary strategies, and I think that that will serve everybody really well when they are complementary. I think that lots, when we talk about joining up data and providing that better experience for patients, we can't do that as in an island or in a silo. We really depend on that collaborative working and being able to make all those things line up and to think about the journey that a patient goes through when they gain access to health and care services. So I think very much about being complementary, not about kind of taking away the local focus. Clearly each organisation has its own particular priorities to attend to, and we've kind of got we're working in a always perpetually in my kind of 15 years in digital health, there's always been a challenge to address, and I think kind of what I kind of call turning the dials up and down on kind of some of those key organisational metrics. So it's just thinking about how all that stuff balances out. It's really complex, it's fair to say.
I'm sure it is. Yeah, you touched a little bit on the power of data, and I think we talked about it before we started today. But tell us a bit more about that. I mean, I think it's commonly known, or people say that really data is the lifeblood of the NHS, and has the power to really transform how we deliver care. Analytics, personalisation, all of that kind of good stuff. But in your role as a CISO, with a vast ecosystem of organisations wanting to kind of exchange data, and how do you even begin to start managing that?
What I would certainly say, transition into my new role and having information governance as part of my portfolio has been really, really kind of eye-opening for me. And I've really valued having both the IG side and the cyber side in my portfolio. It's been so really thinking about how do we bring those two professions together. How do we make sure those things are complementary, and how do we make sure that we have a really kind of clear and smooth process in terms of getting through those kind of bits of governance. And there's certainly parts that I'm now thinking of in terms of, okay, well, if we can move cyber and IG more together and make that more,
they feel like they should be part of the same. I mean, they are, right? Yeah,
it's really interesting, and certainly one of the areas in particular where, and now props to the IG guys, it gets really complicated from a legal perspective, is when you get into that data sharing, and particularly when you're getting into data sharing for secondary uses, when you're getting into sharing data for research purposes and those kinds of things. That's really kind of really challenging area, and where our IG professionals are kind of working at the top of their license, as it were. So I think certainly I kind of came in thinking it's going to be a lot of stuff around DPIAs and those, and thinking about data security and protection toolkit. It's been so much more than that. It's been really interesting for me, and I've had IG in my portfolio in the past, briefly, but certainly it's the work that I was doing there versus kind of what I'm being much more involved in now is significantly different. And having done some of the patient engagement recently for the 10-year plan, what came across very clearly is that patients really expect their data to be protected. They really expect that transparency in terms of what's being done with data as well. So really important. Lots of lots of work happening at various levels around data, and it's quite a complex world of federated data platform, and then you've got subnational secure data environments, as well as provider organisations needing to do things with their local data, and then that kind of systemic piece. So it's a really complex kind of setup, and I think certainly there's the what I'm kind of starting to see happen for many systems is we are doing that piece where we're through some of those programs, we're kind of starting to think at system level and think about, right, okay, and particularly with things like integrated neighbourhood teams, where we are saying, right, okay, well, we've got these groups of organisations that are all going to work together at a hyperlocal level. How do we give them what they need to be able to have a real impact, but also to be able to measure that impact? So it's a really interesting space, and I would definitely not say I'm a native in the world of data, but certainly I think it's going to be critical. I think what we have to be wary of, particularly when we think about our EPRs and that kind of the point of care use of data is really great that we've got this interoperability and we're all sharing data. Speaking to frontline clinicians and also to patients through the 10-year plan engagement. I think from a clinician perspective, there's that real demand for can I have that really real summary view of everything I need to know about that patient, so that I can consume that very quickly, so that I can
point of care data, right?
So and I think that's a real challenge in terms of the more data you pull into one place, that's great because we have visibility of it, but we still have to work through that data to make it useful at point of care. So I'm really excited about potentially what might be available to us in the future around how do we use AI, and the safety case around that is a really challenging one for us to get right. But I'm really excited about that because that's a very clear, very tangible benefit. So if I was working for an EPR supplier right now, I'd be really focused in on that. And I think when we spoke to patients through that journey, I certainly heard kind of loud and clear the patient side of that. There is still the element of doesn't quite feel like when it gets to that point of care delivery, that there's that real solid understanding of me as a patient, and I think that's where we clearly want to get to. It's good for it's good for patient satisfaction. It's good for satisfaction of our staff as well. So we've certainly got a long way to go for that side of the data equation, and I think we've spent a huge amount of time over the past decade focusing on, well, let's get all the data flowing. I think now we're going to get to the challenge of that kind of how do we turn that data into something that we can consume really easily, and to really drive that kind of efficiency.
After all these years, why haven't we got the data and all the tools and the technology and the investment? What's stopping us from having that information at the point of care?
I think it's a really kind of, I guess, distributed market, and I think the question I know from people that I know I've spoken to that don't work in digital health is, well, why can't you just have one system? And it's a really interesting one, isn't it? But if we think about the kind of the needs of and just how specialist many of the EPRs are based on kind of different parts of the health sector. It's I'm sure there'll be an EPR vendor out there vying to say we can do everything. I know there's at least one that's made that bold statement. But I think there's the reality of it's going to be a really long journey for one organisation to really get that right, and to really get that right in the context of UK healthcare. So it may well be that there are organisations that have got that done internationally, but how do we get that done in the context of UK and particularly the way that we're kind of funded slightly differently to many other countries that may be further ahead on that. But what we do have in the UK is that No, we are perceived to be in a really great place around that kind of interoperability and getting data to flow. But I think largely what is challenging is many players involved. We have those interoperability standards to work to. We really need to think about making sure that when we've got that buying power, we're really building in those requirements around how do we join up data, how do we make it flow? Because once you've procured, that's when you lose lose a little bit of that power in the relationship.
Yeah, it's interesting. I mean, you've said a lot there for me to remember what I wanted to talk about. But one of the things was around system procurement and the buying power that you mentioned. I think lots of people at a system level were talking about these big joined up system-wide procurements. It feels like EPR, a good example. There are pockets of London and other regions that are doing that, big Cerner rollouts and Epic rollouts. But is that the next step at a system level for, system-wide cyber procurement, so that you're all kind of investing into the same platforms? And do you see that being the way things are going?
That's a really good question. I don't think it's the panacea. I don't think we have to do everything in that way. And I think we have to give due consideration to the cost of change, and really think about the benefit of that kind of where we are doing that convergence, making sure we're doing it for the right reasons in the right place. And I think certainly one of the things that I have definitely felt from a cyber perspective is actually the way, particularly some of the national funding, way that flows in terms of it's very capital heavy, which is challenging for some organisations to consume, or they just can't take it, which then makes it quite difficult for me to go, right, okay, well we've got this chunk of capital funding. How are we going to make the most of that in terms of kind of that system-wide benefit? Because you've got all sorts of challenges around kind of, you can't just go, right, okay, we're going to buy something for the system. Well, you potentially could with the right collaboration and agreement. This is something for us to work on. But now, even saying, okay, well, we'll take that capital and we're going to bank it with one organisation, that organisation is still going to feel the capital depreciation hit of that, and still going to have other implications for them as an organisation, particularly where it's kind of your public dividend capital. So I don't think it's the kind of the panacea. I do think there is an element around, certainly we'll be looking at over the spring and into the summer, really looking at, okay, well, what are the respective kind of infrastructure architecture plans, and how does that fit in with cyber? And really doing that analysis of, right, okay, well, organisation X is doing A, B, and C, and actually that we're all quite well aligned on these things, but where are we going in different directions? And let's talk about that, because, and it's not necessarily with the perspective of we'll talk about it, and the objective of that conversation is we all do the same thing. Yeah. But actually, the objective is to understand, okay, well, why? What needs might you have identified that maybe we haven't identified? Sure. And I think now many heads working together is helpful in that respect. So certainly we'll be focusing on some work around what that infrastructure architecture roadmap looks like for individual organisations, and what that might mean for us as a system. And having those kind of conversations around, right, okay, well, hang on a minute, we've got two organisations that are both going down this route. Could we do that together? Could we look at kind of maximising some of that buying power? So certainly there's work to do there, but no, I don't think it's the panacea, and I think that's probably something that coming from a CSU where it was really trying to do things at scale, we kind of had 45,000 users that we were supporting over a really broad geography. Yeah. Clearly standardisation was our friend. Sure. And adoption of national platforms was super helpful as well. But I don't think it's the be all and end all.
You've touched on it very briefly there, but what's been the kind of main differences of working there versus where you are now? Yeah,
so started out, so my CSU journey was, and I worked really closely with Arden and Jem, but kind of worked out of South Central and West. But the journey there was really interesting, I think, and I really enjoyed being part of the CSU team. I think the model is super interesting in terms of having that kind of internal delivery partner that is reinvesting money back in to deliver services. And I think the concept of being an NHS organisation that has other NHS customers is a really interesting concept. But it was a real journey, did a number of roles there. But I think I guess really the first kind of couple of years of that journey was very much about almost this same challenge that I know many systems will be looking at now in terms of that kind of what does a technical roadmap look like? What does convergence look like? How do we bring those things together? How might we want to standardise? So it's very much about that. But also we had the power there of really transforming the operating model. We kind of had all the people under one roof, which is a very different challenge to system working. So we did lots of work there by almost going, right, we didn't really have a roadmap. We kind of established a placemat to say, right, every change program that we're going to go through, this is the architecture that we're going to try and get to. And actually over a period of time, by just kind of following the placemat, we got closer to where we needed to get to. And certainly that got us to a great place in terms of being able to respond to COVID. So I know we'd very quickly got to a point there where it was like, right, even things like telephony, that's all we're going to virtualize all of that. We're not going to have that on desk. Everyone needs a laptop. We're gonna move away from having various different file shares for different legacy organisations, bring that together. And I think when you then get that kind of service served us really well. We were kind of, you get the notification around COVID. We were able to step away from the office, and we were able to kind of step into playing a really important part in the COVID response. So some of the work that was done around kind of COVID call and recall, it would have been much more challenging to deliver that without the ability to work in the way that we did. People in the team rolled out Teams to 40,000 users in a matter of days. It was the power of that experience for me is something I kind of whilst it was a very difficult situation for everybody. I think that collaborative working within the team but beyond organisational boundaries I think is something that certainly now looking back in 2025 I think there's almost a bit of I quite like a little bit of that kind of that back at times, because there was that really sharp focus of this is what we're here for, this is what we need to deliver, and the environment to kind of really encourage people to kind of to push and get things done and kind of take out those blockers that might ordinarily stop us doing what we need to do. Yeah,
I remember that period, and we delivered unified comms for South East London, remote access to enable all of the GPs to fall back to remote positions and be able to continue to deliver care. And I think my take on it was, we praise everybody on the front line, rightfully so, for the work that they do, but the people that are sometimes behind closed doors kind of keeping the lights on and working on infrastructure and data and platforms don't really get the kudos that they deserve. And that period of time, it was largely down to the techies and the brains behind the closed doors that managed to keep the NHS running and patients and communities continuing to get the care they need. So it was technology really being used for good in that period of time. So very, very profound moment in recent years, I think. Without breaking confidence, cyber's clearly has been and is going to continue to be a hot topic outside the NHS and within it. What are the sort of key trends or areas of concern or focus, again, without breaking confidence, for you or the system as a whole, do you think?
I think it's been a really interesting few years. And that's really big picture. It's been an interesting few years. So if we look at the kind of geopolitically, and I'm sure by the time this goes out, it will have shifted again. So certainly, the fact that there's a war happening on mainland Europe is driving some different interests, some different activity than what we've maybe been accustomed to in previous years. So now I think we've kind of the kind of health and care kind of almost being off the menu for organised crime and kind of cyber criminals, that
No longer the case.
Doesn't feel like it's the case anymore. And I think the way that the bar is getting lower for those people to be able to launch attacks. So you can go on the dark web, you can buy kind of exploit kits, you can buy automated tools that will help you target organizations, and now you can kind of launch your kind of ransomware type attacks without having loads of technical nous. So now that's clearly, we need to move to a place where we can respond to that. And I think there's still definitely a bit for me around, and I kind of describe this when I talk to people about it, is it's your crime has gone from a burglar walking down the street and kind of trying to see if doors are unlocked or windows are open. That's kind of gone online, but the behaviours are still very similar. So looking at things in terms of, okay, well, where have we left those digital kind of doors and windows open? Having that kind of outside in view of, right, okay, well, where are we vulnerable, what things do we need to close down?
Absolutely.
That's really key. So I think a real focus on kind of that web presence and making sure you've got that outside in view to be able to say, right, okay, well, if I was an attacker, where would I start? Probably go here, and really then trying to start to get on top of those things and making those decisions in terms of how do you kind of protect those services. So I think that real move of healthcare's no longer off the menu, things are becoming much more commoditized, is a really key change. But I do think the fundamentals are making sure that we're kind of doing that, shutting your doors and windows digitally. So
sure.
Things like making sure you're kind of your remote access. So I think we've seen time and time again organisations get hit through lack of MFA, or particularly through kind of Citrix architecture, and generally not
difficult things.
No, they're not hard. They're not hard things to do, and that's what we really need to kind of be focused in. It's not big and it's not glamorous, and there's not a company going out there doing the marketing for applying really really solid but quite basic fundamental security controls, because frankly there's not a lot of money in that. There's money in go and buy the software product that's going to solve sexy stuff that's going to solve all your problems. For me, making sure that you're in control of your passwords, your permissions, your ports, those kind of basic fundamental things.
Basics.
But if you can be brilliant at the basics, then whilst we are kind of, I said, health and care is no longer off the menu. Health and care is broad. There are lots of different organisations, but also we're kind of, we're probably going to be quite broadly looked at across various different sectors. And it's kind of, if there's a house, that virtual house you go past and it's got all the doors and windows are locked, are you gonna kind of smash the windows, try and get in and take that time and take that risk, or are you gonna go, I'll move on to the next one? So I kind of, it's kind of like being the like the grey person in the middle, where you're kind of you're not lagging at the back and kind of exposed. And I really, I think kind of hoping to be in a position where ahead of the curve, and kind of not an easy target. That's kind of, I think, a really basic fundamental of where we've got to get to. Yeah,
it's interesting. I think certainly the conversations that we have, clinical, more operational colleagues rather than technical, they kind of look at IT and cyber and say cyber's your problem or thing, but I'm sure you'd agree that you're only as strong as your weakest link, and it's more of a cultural position, isn't it? How do you kind of deal with that at not only at a local level, but at a system level where you've got 15, 20, 30, I don't know, 100,000, members of staff?
Yeah, I mean, I think there's definitely a bit there around the kind of how, people kind of feel IT is a very tangible thing and cyber is quite an intangible thing.
Yeah,
they go together. A really significant chunk of cyber is application of IT best practice. So there's a really solid relationship there. But cyber's scary. going and buying a system, an IT system that does a thing that how you would use it operationally no longer kind of feels scary. So, and I think there's certainly a risk as you get that that kind of democratization of IT, where and the opportunity to that your shadow IT type stuff to really grow. That's a real challenge. So I think for me there's a real focus on, well, how do we very clearly articulate what the expectations and requirements are, make them accessible, make them visible, and support people. Because we don't want to be a blocker. We still need to make sure that we are working with small to medium enterprises that are doing something that is really innovative. We still need to work with those organisations. So what we can't do is we can't put up the shutters and say, the bar is this high, because you'll never get the outcomes from the systems that you're looking to go and get and the innovations that you're looking to make. So we have to find that balance between what's the risk, but we also have to make it, the kind of those requirements as accessible as possible. So certainly for me, I'm really looking to lean into what's out there already in terms of frameworks.
Yeah.
So when it comes to let's say you're going through a procurement. Now, let's not ask 20 questions. Let's ask a much smaller, succinct number of questions, but really focusing on kind of the use of frameworks and standards, so that we're not boiling the ocean and creating loads of barriers. We're taking sensible, risk-based decisions.
Yeah, makes sense. You talked about, or you mentioned there, shadow IT. I was talking to a CIO colleague recent weeks about shadow AI. How's that kind of playing out across Southeast London, if at all?
So
how are you managing it?
So one of the things that we've published this week is an AI framework, and that's been part of the kind of a One London work. And actually what's really helpful there is really breaking down the use cases and really giving some guidance on that. So the next part of that, and I had the conversation yesterday, and we're trying to do it jointly as a information governance and cyber community, is to elaborate on this is how we're going to use AI in London. Elaborate that into, this is how we're going to use it, but also this is what we're going to do to protect it from a privacy and from a cybersecurity perspective. So again, setting out those kind of key frameworks is really key. I think there's the bit around we always have to balance in technology, whether it's AI or any other technology, and particularly where you've got the opportunity to adopt things, software as a service basis through a web browser, that kind of thing. There is always that challenge that people can just go and do, and then you'll kind of have to find out kind of after and work out how you kind of retrofit it. So I think there's a really key bit there around the kind of the education piece, being really clear about expectations, and actually trying to get to the position where through the your IT business partnering type function, actually understanding those needs as they're coming out, and kind of trying to think about, what needs to go into our portfolio of what needs to go into our change program to try and get ahead of this, because if there's a vacuum of capability, people will fill it. So it's really important for us as leaders to be in touch with people that are working locally with colleagues. And I think it's the whole change that I've seen in my digital health career of the real prominence of kind of clinical colleagues working in a very embedded way with the digital team is really powerful to help us through that sort of change. So I think it's definitely it's definitely a challenge, because but it's a pretty similar challenge to any other particular application that you could kind of go and pick up off the shelf, albeit with some slightly different kind of privacy type concerns.
Yeah, because there's a lot of hype around AI clearly at the moment, and some of the use cases we're seeing in health are predominantly around things like the use of Copilot or some automation capability to help speed kind of labour intensive processes up to give more time to care back to people on the front line. Is it overhyped though? And where do you see the kind of more forward thinking potentially use cases? Is there anything on the roadmap or anything that's kind of exciting you about the potential?
Yeah, I still feel like it's kind of too early to say in terms of how we going to kind of get to the point of quite clear commoditization.
Yeah.
So I think there's lots of work in the startup space, as you would always expect. There's the shiny new thing, and then there's venture capital that then follows the shiny new thing normally. And we know we've seen that loads in digital health over the years, right? So I think definitely there's opportunity there. I think there's the, as always with any time you have, particularly with new market entrants to digital health, really making sure that there's that connection between the technology, but actually the core purpose. So what's the problem that we're trying to solve, and what's the value proposition of that? So I've certainly seen, and to be honest, got a little bit tired of seeing organisations that have kind of gone to market, haven't landed in market, and kind of they've sadly haven't then kind of kicked on as an organisation and kind of haven't survived in the market, but actually kind of bringing in that blame game of, oh, we had a great product, but no one decided to adopt it. And it's like, well, you need to be really focused on that when you're going to start to work in digital health. You need to work out what's a value proposition, who you're going to work with, and how you're going to get it adopted. And I think it's kind of, it's always an interesting one where you kind of see that. I know it's sad that we've had an exit from the market, but then the kind of the blame on, oh no, the NHS is too difficult to get into. And I think we've kind of, I think we've seen if there's a need that is there and is well met, then actually you can, you have seen organisations that have been new market entrants scale really quickly and get really great coverage, and particularly certainly through COVID, organisations that got their kind of their go-to-market type approach right through that period have gone on and done really well. So yeah, that's probably a bit of a meander from the question.
No, I think it's good. I mean, I think certainly in our experience, referenceability is really critical. So kudos to the organisations that, as you say, have kind of gone from zero to hero overnight. I think that takes a tremendous, there must be some real value in what they're delivering to NHS colleagues. I had this discussion with David Newey around the role of a CIO, and I think CISOs of a very similar ilk, where I've no doubt many people aspiring to get to that position. Tell us about mentorship and leadership. Have you had any particularly notable mentors or people that really guided you along the way? Any key lessons or learnings from them?
I think certainly for me, I definitely try and take something from every person that I work for. Kind of good or bad. There are things that you can pick up in terms of, okay, well, when working for that person, they did this and that made me feel this way, so maybe that's not something I'd want to do. But loads of really great lessons from people as well. So I think certainly I kind of feel like I'm a bit of a patchwork of the people that I've kind of worked with and worked for, and I kind of try and take those things where I kind of reflect on, right, okay, well, how do I feel today? And I try and do it kind of daily. How do I feel today? Why did I feel that way? What happened that made me feel that way? And then kind of try and weave that back into where my kind of really helps me go after my kind of passion and go after the areas that I need to develop. So I've definitely had some really good kind of examples on the way. So I worked for kind of 6.5 years for Simon Sturgeon, who was fantastic.
I know that name.
So Simon's been around for quite a while. He's CIO down in Solent before going to the CSU, and I think, to be fair to him, he kind of inherited me from the previous kind of IT director, who kind of recruited me as one of the last things that he did.
Okay.
Which is always an awkward way to start a kind of professional relationship, both kind of starting new within a month. But I think certainly his kind of really calm approach was something that I really needed in terms of kind of my development, and I think at times could be kind of very much always kind of pressure on, foot to the kind of floor.
Yeah.
And kind of his ability to really kind of step back, stay calm. I learned a huge amount, and kind of certainly I think the role that I kind of played in that leadership team kind of evolved over time as well.
Okay.
And
what way?
I think certainly kind of I probably mellowed quite a lot more.
Oh, really?
And as I think you
can't imagine you being more.
You kind of pick up those influences, but I think it's really interesting. Every leadership group is different, and I think as a leader, there's definitely that part around thinking about what can I do that makes this leadership group more effective.
Right.
So do I need to be the person that's kind of turning the screw, putting the pressure on, trying to give us that kind of that spark and that push, or am I the person that kind of needs to bring that calm and just kind of just help us kind of level off and reflect in the right times and think about kind of team dynamics and how we work more effectively together. So I think for me, I kind of, and that leadership style I think has got to be quite flexible. But yeah, coming beyond Simon, and I worked for Neil Bennett, who went on to be CISO at NHS Digital. Before Mike Fell joined, Neil was great. He had open door policy all the time, and people couldn't quite believe how he did it. And I still can't quite work it out. But he was great in terms of his leadership of the team, because you always felt supported. You always knew you could go and ask. But he was also, certainly for me at the point in the career I was in, really encouraging. He kind of said, "Right, look, you've got it. Like, go. You're fine.
Yeah.
Like now what I need from you.
Autonomy. Yeah.
You've got the autonomy. Go for it. And tell me, come and ask me for forgiveness a bit more often rather than permission.
Yeah.
So that was great as a kind of as a confidence builder.
Yeah.
But I think probably one of the really interesting ones, and it was very brief. When I kind of made the decision that I wanted to go and be a CIO, this was many years ago now. Somebody hooked me up for a conversation with Rachel Dunscombe, who's gone on to amazing things, and just that half an hour about the realities of going from working in a national organisation to going and working in the trust.
Yeah.
Kind of, really. And that really helped me make that transition when I first went to work for a trust. Really helped me kind of be prepared for the environment, because it was a really different environment for me, kind of going from working on big national programs to being in the middle of a 24/7 operation.
Yeah.
So
how did it help?
So I think it was definitely that kind of that cultural transition in terms of what it was like for her to be a leader in that organisation, and kind of what was required, and kind of how that would probably maybe be slightly different from what I was accustomed to, kind of being involved in big national programs, but also just some of those kind of, I think the human tips. As well, and I'll keep my counsel on those, because they were really valuable, and I certainly wish that I'd maybe managed to follow them a little bit more closely some of the time. But that was great as well. And I think the power of the network is fantastic. The great thing we have in public sector and digital health is you can always pick up the phone to somebody. So now certainly I've been in a position where I've been going for an interview at a kind of organisation where I maybe hadn't worked for before. Now I've got people that I've picked up the phone to, and I've said, can you just help me with this? And actually the help that they've given me has always been way more than what I've asked for. And that's just a wonderful thing about the kind of the digital health community that I really love. So certainly for me, I spent a period of my time where I kind of didn't really engage with it that much, and probably suffered for it. I would say, I think since I've become much more open and much more engaged with that sort of thing, and Joe McDonald gave me the advice of go and talk to strangers, and actually that's where the magic happens.
Yeah, brilliant. It sounds like you've gained a huge amount of self-awareness. The earlier part of what you talked about there was, sounded like you are extremely self-aware, and that leading with empathy and understanding that it's really about people and communication. I think over leading with an iron fist is how you get the best out of people, right?
Yeah, absolutely. I mean, people come to work to do to do their best, and I think there are very few people that come to work and kind of don't have interest and passion. I think certainly going through the kind of the challenges that we have in health and care, it would be really difficult to kind of to keep coming in every day, right? So I think really that kind of leadership role is about, well, how do we get people working together? How do we help people to be their best? We don't have a massively compelling offer for people financially. You can go and work in financial services and earn a whole chunk of cash. I'm sure. It's got to be about purpose and being part of a team and development. And I wouldn't say that I'd always got it right. And I think you can always reflect on kind of situations where you kind of go, well, certainly reflect on when I started at the CSU, and kind of I still haven't quite made my mind up about the approach that I took when I first started, because I was probably a bit more foot on the pedal and a bit more right. Okay, well, I think the horizon is over there, and let's go, rather than doing that more kind of collaborative approach of going, right, okay, well, where do we think we should be going, and kind of that sort of thing. And I probably have flip-flopped between, well, was that the right or the wrong approach? But I think the key thing is, if you reflect on your approach, what you're doing, how you're feeling, in particular, I think feeling always drives how you act and behave, and that then kind of drives how people feel about you.
Super interesting what you said about the offer, and I'm kind of thinking about retention of staff, and I think I read in the paper last week that retention of NHS staff is at an all-time high in recent years. Did you read that? And
I didn't read that, but I think certainly certainly I've seen it in the numbers and on the ground. So certainly when I was at SCW, we every month we'd look at our turnover figures, and they were always well within what we'd kind of expected to be, and that's great for continuity. And I think there's always that balance to find. I think if you end up with no turnover at all, that can bring its own challenges as well. So I think there's always a bit of a kind of a balance to find between bringing in new ideas, new experience, but also kind of maintaining that core. Because I think a lot of the work that we do, it's we really benefit from the people that have kind of got that knowledge. And certainly in South East London, I've kind of found a couple of people who I know I can kind of go and knock on their door and say, can you just tell me how this works? And they know it because they've lived it for the past kind of decade. And that is really, really valuable.
It's not what you know, it's who you know, right?
I think it's probably a mixture of both, right? And I think there's certainly a really good power of a professional network to be able to kind of help you along the way, and kind of bring in insights and lots of this stuff. Health and care, where lots of the time your organisation is not going to be the first organisation to do it. So actually that kind of, we talk about leadership, but also there's a kind of, I quite like the principle of followership as well. So actually looking at what can I learn from other people that I know that other organisations are doing as well. So I think certainly if you've got a really good who you know network, then actually you're going to power up the what you know. So I think they go hand in hand.
You say followership. Are there people that don't know what they're doing in the NHS in roles similar to yours?
I wouldn't. I think that would be a bit strong. And I think there's certainly like in any industry you're going to have kind of challenges, and I think there's definitely a real need for organisations to really think about the skills and the capabilities that they need to deliver. But that's not all about having it within your own organisation. So I think that one of the things that kind of coming back to that followership point, we could maybe do more of is actually leveraging partnerships with other organisations. So I think we are all so passionate about developing people, giving them opportunities, letting people want to work on new stuff. But sometimes we probably overdo that, and we kind of say, right, okay, well, we're gonna do this in house. We've not done it before, and it then takes us longer to do than potentially if we picked up the phone and went for a lengthy procurement probably to get some external support and get somebody in that has done it and can do it very quickly, but can show us how they've done it and we can learn from. So I think there's definitely a piece for us within the NHS where we can be a little bit closed off to industry and to partnership, because we want to do it all ourselves, but we suffer the consequences of that. And I can see why organisations do it, because now procurement can be a challenge, funding can be a challenge. You're not always 100% assured of what you're going to get, and now sometimes the complexities of platforms working together is challenging within the NHS, particularly where we maybe have some platforms that are a bit more closed or a bit more difficult to kind of integrate with. So like your kind of UNHS.net type stuff is an example of having an organisation that can do stuff that works around that ecosystem. Now that's quite a niche and bespoke thing. You're not going and getting something that's commodity where you've got your own thing and it's just configuring a standard Microsoft service. So I think I wouldn't say we've got people, we've got loads of people that don't know what they're doing, but I think we've definitely got an opportunity to look at how we partner outside of health and care to improve and kind of enhance and kind of augment the capability that we've got.
With suppliers or with health organisations outside of London or the centre or
I think
third sector?
It's probably all of the above. All of the above, I think. I think I probably point more broadly in terms of kind of your commercial partners, suppliers. Right. So certainly I think there's a real opportunity for us there to look at that. So certainly thinking about as we start to consider our kind of technology roadmap type stuff. Sitting in a room with all your tech team and saying, right, okay, well, what should we be doing about our tech platforms for the next 5 years, and not having a kind of a partner or an outside kind of an outside voice in there for kind of some of the art of the possible type stuff. And I think is a real miss. But I think sometimes we don't quite know how to use those partnerships, or maybe sometimes we worry in terms of, right, okay, well, is that allowed, because there might be procurement implications and that kind of thing. So I think definitely, I'd always urge organisations to think about, okay, well, who outside can kind of come and help us and have a conversation with us. And I certainly in my last organisation where we were doing lots of work around the cloud, we lent really heavily on partners. We went down a hybrid route in the end, and then had to move a data centre, which was really painful. But actually it got so much less painful when we brought in people externally that had they'd already worked with that kind of new data centre partner. They'd done loads of migrations in there. They knew exactly what the pitfalls were going to be. They've got the experience of doing it. And actually, in terms of that program delivery, we massively accelerated just a result of having that experience of having done it before. Yeah,
it's interesting, isn't it? The supplier community at times gets a bit of stick, really, doesn't it? But with respect to colleagues in NHS organisations and even private sector organisations, they may have only gone through certain transformations or programs of works maybe a handful of times, whereas suppliers might have done hundreds or thousands of them. So they do bring an additional level of experience, perhaps a different perspective and view and understanding to the table that makes a difference, right?
Yeah, I agree, and I think there's definitely a piece around making an effort to understand health is important.
From a supplier perspective,
yeah. And certainly I would kind of tend to lean towards organisations that have done it, but have kind of done it in healthcare or kind of in an adjacent kind of market.
Why is that so important?
So I think I think it's about kind of I think it's about context. Nobody sets out to kind of have an architecture that's not perfect, but fundamentally we all have to work within constraints.
Yeah.
And for healthcare, the constraints are they're very similar to local government and various other government organisations as well. But I've certainly seen organisations come in and kind of say, okay, well, this is what we did in banking, and gone. The room is gone. You've completely lost the room because this is what we've done in banking is kind of such an alien concept for organisations where they go, I just can't see that relevance. And it kind of I think when we are getting into the kind of nitty gritty of delivery and making things happen, trust is really important. And I think you kind of it undermines that trust by going, right, okay, well, it kind of has the feel of we're going to come and try and do to you something that we've done in a completely different sector, and we don't really know whether it's going to work or not. So that's that creates anxiety for people, and yeah, that then starts to kind of you hit roadblocks when it comes to delivery. So I think definitely that having that will to kind of understand the challenges and kind of think in that context is key.
Important. Yeah. It's interesting, isn't it? Because I think over the years, even far beyond my time, the NHS has gone through this kind of merge, disaggregate cycle, and equally insource, outsource. Have you got it right in South East London? What do you think the kind of pitfalls and the pros are to those? That's two big questions there, I think, rolled into one.
I think it's really, I kind of reflect on a conversation I had with someone very early on in my career. And when I was working at kind of Connecting for Health or Health and Social Care Information Centre, and we kind of talked about that cycle of kind of the cycle of in-house managed service, managed service. And I think it's not I don't think it's uniquely a health and care thing. And I think it's a kind of a broader kind of sign of the times type scenario. And you get that back and forth. And I dare say the whole scenario with we've gone from very on-prem architectures to very cloud focused, but before the on-prem it was managed service, which was largely someone else's kit, or your kit in someone else's space. So I don't think there's a kind of a right or wrong answer. I think it's always contextual in terms of how do you bring together the people, the process, and the technology. So I think that absolutely times where the best thing that we can do is say, you know what, we're going to pick this service up and we're going to let someone else take the reins on it for a period of time. And even if that's with the intention of bringing it back in 5 years, to then go, right, okay, well, we've kind of that transformation that we needed to deliver that might have been quite challenging for us to do culturally. Actually, we've moved it out. We've let someone else kind of go through that change period, and then we've taken it back. And that can be really valuable. And we've seen plenty of industries do that. I know there are kind of airport groups and that kind of thing that have been on that journey, and kind of gained from it. So yeah, I don't think there's a right or wrong answer. I do think it will always be cyclical. And I do think there is an aspect of, certainly for me, coming from working at a commissioning support unit, and then making the decision to go and work for an ICB, it did feel like that there was so much more focus on that system working, and
at the ICB,
and within integrated care systems generally. So ICB is really looking at, okay, well, are we going to commission? Are we going to continue to commission CSUs, or are we going to do it ourselves, or are we going to do it through a partner in our system? And so, it did feel at times like we were kind of in that part of what we were doing. It kind of felt like you're swimming against the tide a little bit, despite offering a a great service as well. So I think organisationally doing a great job there to kind of to look at, okay, well, where are we supporting other parts of kind of health and care. So really proud of the folks that I kind of left behind working in support of NHS England across various programmes. So now I think there was that balance, but certainly it kind of feels like at the moment we are culturally very much kind of inwardly focused as integrated care systems to look at what can we deliver ourselves.
What's going on at the centre at the moment, do you think?
I think it's really interesting, isn't it? I think the reality is that relationship between Department of Health and Social Care and NHS England is really interesting. If you look across other government departments, like, yes, there are kind of many arm's length bodies, but I think NHS England works in a reason. It feels like it works in a reasonably kind of unique way. So I think it must be incredibly difficult. And I think back to my colleagues that I worked for when I kind of first started in digital health, and certainly there's one person that I worked with who I can't remember how many name badges we'd got through in terms of organisations that he'd worked for.
Right.
But I think he would know, and he'd had a long career. But he's into the double digits, right? So that's a really challenging environment to work within. And I think new government always brings change, and certainly the constraints that the new government have got to work within are bringing a certain kind of change that I feel for people it's going to be a difficult period to go through. But I guess kind of coming back to your previous question, about are there people that kind of maybe aren't fully at it, and I think lots of the people that certainly I've worked with really closely in the centre over the years have been really on it, really know what they're doing, and certainly having to I certainly don't envy that kind of point of trying to bring together the political will of secretaries of state, etc., and then the operational delivery all the way down to kind of integrated care systems and then beyond. So now it's a tough job, and now I know the NHS England director for CIO at the moment. And I think every time that role comes up, I think there's always a bit of conjecture across digital health in terms of, okay, well, who might be the best person for it, and I think that the challenge is kind of always finding the balance between, well, who's going to be great at it, but who's also kind of got that resilience to take it on, because it's a huge job. It's a really huge job, and I think you can't keep all of the people happy all of the time, and I think certainly the centre that is probably amplified.
Yeah, that's John Quinn's role, right?
Yeah.
So looking for his successor, and equally Amanda Pritchard stepped down and she's been replaced, I think, as well. Yeah, so lots of change. Temporarily
replaced. Right. So I think I should believe there'll be a kind of a recruitment process for that as well. So certainly a kind of somebody kind of coming in and coming in under kind of new leadership as well. So always a challenging role, and tip of the hat to anyone that's going to throw their hat into the ring for that one.
Absolutely. Yeah, I was talking to a CIO colleague the other day again, actually, and we were talking about the budget and the announcement, and it was all spread across the papers, huge sums of money going into health, and he laughed and said, "There is no money. It's all a load of nonsense." Is that? What do you think about the funding and that kind of announcement? Are you seeing that at a system or a local level, that it's not really transpiring into flowing down to place, or?
So probably not so involved in too much of the funding side, and right. of course kind of moving in from a CSU, which is funded in a very different way, into an ICB is definitely a kind of a change. going from a self-funding organisation where, ultimately if everything doesn't balance back to zero, then the organisation kind of doesn't exist, and we saw that with a number of CSUs. So it's been a really interesting kind of change to go through. I think certainly there are the challenges and constraints to work within. I think South East London are kind of working to a planned deficit. So
right.
That's not where you want to be, and I know colleagues are senior colleagues are thinking really hard about where those compromises come. So so it's really challenging, but I think ultimately the funding is year to year. So how that kind of then starts to flow through the system and then land is really interesting. But I think from a digital perspective, I think the challenge for me from a funding side is more so about about kind of the nature of the funding. So I think and I think this is probably a public sector challenge more broadly. I don't think it's a unique digital health thing, but it's that consistency of funding. It's having that funding recurrently, and kind of being able to move to a place where we're funding teams rather than funding projects, and having that kind of that constant kind of churn of, right, okay, well, there's new money coming in for this particular project, but then we're going to lose the money for the project that we've just delivered. So it does feel like that money that kind of can flow in centrally. It's because of the kind of the inconsistent nature of it, and so largely colleagues have done a great job to try and push these things a little bit further ahead, but lots of the time you're looking at funding that's coming towards the end of the financial year, and it doesn't give you that firm footing to say, right,
it's a plan.
This is a plan. This is where we're going to be. So it does always feel like you can be on the back foot, and I think there's certainly a piece around. We talk loads about kind of how can we improve benefits realisation. I think that the real challenge for health and care organisations is if you're getting the money now 4 months before the end of the financial year, and the money runs out at the end of March. Now you're largely going to be in delivery mode until the end of March, and then you're going to hit April, and the funding's gone. So how do you do that benefits realisation properly, to really maximise and make sure you kind of understand and maximise the benefits? It's a real interesting feature of being in the public sector, I think, but certainly a challenge that we've got to kind of try and think about different ways about how we address.
It feels like a bit of a game in a way that people are having to play the system at a local level, system level. But there's lots of people, aren't there, that talk about decentralisation and how the way the funding goes to the centre and then down and out. There's organisations that kind of feel like the golden gooses who might get some priority and more money for good reasons and for bad reasons, and then those that perhaps get neglected a little bit. Would you agree with that? Or? I think it's certainly it's certainly one where you can kind of see organisations kind of may feel kind of injustice in terms of kind of money. Does money flow in more into one area than the other? And that's a real challenge. I think health and care is diverse, and the role of different organisations and different parts of the sector do vary and do have kind of different cost implications that go with them. So can't keep all of the people pleased all of the time. So I think there is definitely that kind of element to it, and certainly I guess there's a fairly universal belief of everyone would like a little bit more money. I certainly feel like from a cyber perspective and in terms of the day job, there's really that bit around how do we look at the money that we've got and make sure that we are getting the maximum benefit from it. And I think at times, and I've kind of seen this in previous organisations probably a bit more because I've been a bit more hands-on, but that element around we've got this product that we really love, and it's really hard for people to give up because they've had it forever. It's their baby. They put it in the first place, and they don't want to see it go. But actually, on the flip side, we're saying, okay, well, actually, we'd really like some resource to do X and Y and Z. We've got to be bold. We've got to be willing to make those compromises and go,
I love that product and it's really great, but actually there's this thing that we can use that's going to get us, 90% of the benefit for 10% of the cost, or none of the cost potentially with a lot of the national solutions. And then really looking at that, how do we make sure we're reinvesting that money back into actually we need some bodies over here to be able to fulfill X, Y, and Z. I know we've got to be bold in that respect. And I see plenty of organisations, things like kind of antivirus and the kind of the whole Microsoft Defender, yes, no, maybe type consideration. No, so I think there's a bit there in terms of it's an interesting conundrum to be investing in something separate, but also then kind of having the conundrum of, but I'd really like some resource for, and it's like, well, you do kind of potentially have the opportunity to get what you need to. It's just different trade-offs, and I think we can be better at recognizing the unconscious trade-offs that we're making by doing nothing, or by continuing to do what we've always done, and that's not me certainly not advocating for product X over product Y. I think it's just a reality of kind of doing that step back to go, right, okay, that kind of breadth versus depth type kind of conundrum to work through. And there's certainly no right or wrong answers, and certainly I'm not in a role where I'm kind of pushing people to say you definitely need to do this, you definitely need to do that. No, but I think highlighting the opportunities that might be there and the trade-offs is something that I will inevitably do.
Sounds like what you're alluding to without putting words in your mouth is that there's people that are set in their ways perhaps and reluctant to be open to change. I mean,
I think definitely there's in health and care, risk is something that is always there. I think people are really committed to really reducing risk, and that's for the benefit of patients. So people are kind of
very political answer.
trying to I think we're all trying to reduce risk, and ultimately when we change we create risks. And we have the unknown, right? So I think actually how we mitigate that is really looking at how do we pilot and scale. So how do we look at one organisation that's saying, right, okay, actually we're up for it, we're going to go for it, and then look at as a system, okay, let's do a show and tell. How did you get on? What worked? What didn't work? What are the concerns? What might be the gaps? That sort of thing. So I think certainly there's a bit there that we can kind of lean into. And I think one of the really interesting things I've learned from a previous role is just thinking about kind of I think particularly I've probably felt like I've got caught with a couple of products that were new market entrants and really looking to drive out a customer base and kind of looking to then go to market and sell, and you inevitably kind of get caught up a little bit in that and end up in a scenario where you end up having to change. So certainly kind of I've definitely got one that was company got bought out by Google and it kind of wasn't quite the same, and then we had to kind of quite quickly think about, right, okay, well this maybe isn't the kind of the
not what you expected,
not really the kind of that long-term partnership that we'd hoped for. Okay. So yeah, there's definitely it's not a case of kind of you'd always get that partnership right, and particularly where you're looking to kind of do that cost optimization and cost reduction. If you're setting the budget to be quite challenging and maybe perhaps, let's say, not in your Gartner top right quadrant.
Is that really important these days, Gartner?
It's a really interesting one, isn't it? I think that I've certainly heard there are theories in terms of the kind of how do organisations really get into the quadrant, and kind of how does that work, and certainly not close enough to it to comment too much. But I think definitely there is I've done some bits and bobs with Gartner before, and had the benefit of some of their kind of advice and guidance, and it's been super helpful. So there's definitely some benefit in terms of kind of trying to focus in the market. I think certainly for me, what I've felt a lot particularly going into a CISO role, even more so than being chief technology officer, is that demand from the supplier market. Everyone wants to have a conversation, and there are just so many products out there, and it's kind of it's that the market is so broad. It's quite difficult to kind of see that full market. So I think that's where that's where having a solid relationship with a couple of resellers is, or organizations that can kind of bring you different types of organizations and kind of help you accelerate your kind of thinking about, well, what is it that we need, I think actually is quite helpful. But yeah, I certainly don't think it's the be all and end all.
Taking a step back outside of your role within the NHS, as a patient, what do you feel and think about the NHS?
It's a really, really interesting kind of philosophical question about the NHS. I think there's and we were actually having this conversation in the context of what's most important. Is it confidentiality? Is it integrity? Or is it availability? And I think there's probably first and foremost, what I probably landed to is we all expect the NHS to be there for us when we need it.
Absolutely.
And so that availability aspect, we kind of landed on as, no, that's really why we're here. And we, I've certainly reflect on the past where I've been trying to negotiate patching windows and kind of turn things off for a period of time. Certainly availability has felt very much like it's been king in those scenarios. So yeah, I think as a patient, we all have the expectation that it will be there for us and that we will get the care that we need. I've got a number of things kind of within my family where experiences. Right. So my youngest boy was premature, nearly 7 weeks early. So wow. Spending kind of a week, 10 days in the NICU. What a experience kind of as a parent. And I've got a cousin who had in a good or sorry, Michael, in a good or a bad way. I know you think the kind of you kind of. Yeah, in a fantastic way. You go from an experience where you're kind of you're not. I think it's not A&E or no. For me, I was kind of sat at home watching the golf and kind of my wife went, "Oh, I think my waters might have broke," and we go, "Oh, okay, this we've got a bag ready, but this was not the plan." So yeah, and and the care and the specialism that kind of people brought in that team was amazing to see, and really value that. One of the most kind of difficult personal times in your life, you kind of no one expects to kind of be thrust into that scenario and kind of have your baby arrive and the baby's kind of taken away immediately to kind of to go and to go and get kind of some extra support that I need. So I've got a very very deep personal connection in that respect, and now my cousin has had a liver transplant and has gone on to have get married, have a family. Amazing. There's and that's really what health and care is about. It's about what it does for people and what it does for families, and I think it's that's the power of it, and I think that's why we're all here, and I think that's certainly the thing that I try and reflect on when you have those days and you think that wasn't the kind of day that I was hoping for. It's those kind of things that you can reflect on and go, well, it's been there for me. It's served me pretty well. So yeah, let's go again. 100%.
I mean, the reason I ask that is because I find it super interesting when you're talking to somebody who works within the NHS to ask them. I kind of didn't ask the question exactly how, but about their experience and perception and feeling of the NHS. And because, again, the NHS gets a bit of abuse sometimes, but it really is an institution. And, most people have had, sometimes you have a hit and miss experience if, you break your toe or whatever and you go to A&E at 3 a.m. on a Saturday and you're waiting for 4 or 5 hours. But it does some wonderful things to keep us all alive and, stepping forward every day. So good to hear the good stories as well as you know, some of the bad sometimes.
Yeah, and no, certainly not perfect. I've also been in there kind of middle of the night with a toddler with a raging temperature that we couldn't get under control, and kind of, you know, probably waiting a little bit longer than you might fancy. You know, we certainly have. It's kind of, I kind of think of the NHS. It's kind of like the bookend of your whole life. It's there right at the start. It's, you know, it's
so good.
It's going to be there right at the end, and kind of, you know, hopefully not there too much in between those two things.
Love that.
You know, so it's that kind of that constant that hopefully we will all continue to have. And it's not perfect. It's got its own flaws and challenges. You know, but I think certainly I try and speak to people that work in other industries and go to kind of broad industry events and listen to the experiences of people in other organisations, and a lot, particularly digitally, a lot of the challenges that we face, they are not different challenges to many other sectors.
Huge amount of pressure in your role. How do you switch off?
I think there's.
Do you switch off?
So I think definitely. So I would say two things. I think there's mindset and there's boundaries. So I think for me, I try and adopt a mindset of how did I make things better today, this week, so quite a short term focus. And there's definitely the step back moments in terms of, right, okay, well we've got this cyber program to deliver. These are our commitments. How are we getting on? We do a lot of that, but actually, kind of day to day, week to week, how are things better today than they were yesterday? And I think that mindset really helps because it gets you out of the, oh my goodness, there's all this risk, there's all these things to attend to. So I think definitely the mindset aspect is key, but also I think boundaries as well. So. That's something I kind of adopted at my previous role, where I was kind of working away from home and kind of had a young family. I was kind of like, right, okay, well, through the week I'll do what I need to do, and then I'll kind of, I'll probably have my phone on to, if I desperately need to call it weekends, but really trying to make sure you've got that kind of, you've got that life, and you've got the opportunity to do the things that you want to do, and kind of, not doing the thing where you go, oh, okay, well, I'll just log on and do some emails on a Saturday morning or on a Sunday night. I think that discipline around kind of having that, having the kind of the Michael Knight that comes to work and is the CISO in the NHS, but also having the kind of the person who's got a family and other interests and all of those kind of things. So I think if you don't set those boundaries and you don't switch off at the right times, then I think it's not just you that suffers. I think it's there's a price to pay, both for the people that are close to you, but also the people that you work with, because you can't maintain that intensity 24/7, 365. So you've got to be able to step back for those kind of mini breaks each week, but also I tend to find if I've not had a holiday for a few months, then
take one.
I need to take one. I need to take a week and just take a proper break. So I think it's that discipline that you really need.
Yeah, love that. Two things spring to mind. There's a lot of people I know, and I'm sure you're the same in the NHS, that just don't take holidays, like real holidays, and I think, that's absolutely their prerogative and none of my business, but I hope that they do and can take more holidays, because I think it's important for us to truly switch off, not just take annual leave, but still have the laptop open for, a couple of days a week. And the other thing that sprang to mind was David Newey, who, as you know, was on. I don't know if he's still got it, but he has in his signature, it says something along the lines of, and it's probably fairly common at his level and your level, just, if I send you this email outside of working hours, please don't feel obliged to respond. It's only because, and I love that. That's
so certainly that's exactly the same signature on mine, and particularly for me. So one of the things that I'm really blessed to have the support of is working compressed hours. So I work my day over longer days, Monday to Thursday for the most part, and there are of course moments where I kind of work a little bit more flexibly around that. Particularly, so I've got some commitments as a trustee for an education trust that runs about 10 schools. So having that flexibility is super helpful for me. So I do tend to be starting earlier, finishing later, albeit working over normally a kind of a smaller number of days. So I think that kind of not having that expectation and being really explicit about it is helpful. And I have definitely had, I'm not going to name the organisation, but I've definitely worked for an organisation before where I've had where somebody has messaged me out of hours and has then followed up and said, "Why haven't you responded?" And it's like,
that's not okay.
No, and it was it was one of those where I was like, okay, that's an interesting one. Of kind of, you've given me 2 hours and you sent me the email at 6 p.m. So that's an interesting expectation to have. It was probably more reflective of the general relationship. So no, thankfully not someone I worked directly into or was even part of my directorate, but certainly a very interesting expectation. But I think certainly. Did that person kind of get the best out of me or what they needed from me? Was that the way to do it? No, not really. So I'm
a firm believer that if something's really important enough, you'll pick the phone up. And
absolutely, I think that is probably, if there was one tip that I was going to give to people in not just health and care but beyond, is let's not expect so if you send an email and you're expecting a response and you haven't had one, pick up the phone. That is so much more productive than sending another email and expecting a different outcome. And I think actually, coming back to kind of mentorship, actually, so Michael Van Hemert, the managing director of SCW, I kind of, when I stepped into the CTO role, I kind of had a conversation with him where I said, tell me what you expect from me. Tell me what you think is really important.
Yeah, what does good look like? Yeah.
And it was really insightful what he told me, because he told me a story, and I think storytelling is always a wonderful skill to have. And he told me about somebody that had worked for him in a different industry, and he kind of said, this person was terrible at emails. They were pretty poor at email,
right?
But all day they were on the phone. Always on the phone. They would be talking to people all day long, and that meant they could get action from people quickly where they needed to, but B, they also really had their kind of finger on the pulse in terms of what was happening in the organisation, because they were that actually a lot of the conversations you can have, you can pick the phone up and have a conversation about
100%
about one thing, but you then learn about so many other different things. And I think certainly when I was at kind of, to be fair, the majority of my career at SCW, I did a lot of the stuff where I would just certain offices, we kind of had separate spaces for different teams. I'd kind of make the effort to kind of go around the office and go and speak to people and ask them,
absolutely,
what's going on, how are things, is there anything that you need from me? I think that's a kind of a habit that I've kind of taken with me into South East London, and it's really interesting. A colleague kind of picked up on it, and they're like, well, you're always kind of
walking the floor.
You're always walking the floor, and you're always asking people about how they are and what they need. And there's so much value in that.
Yeah,
you get to learn about what's really happening. Because I do think one of the big leadership challenges is people can be uncomfortable telling you the reality and the real truth of kind of what's happening operationally. And I, particularly when I was at the SCW with a team of at one point kind of 400, people kind of they may only see you in office kind of once every 6 months, and then see you on a Teams call a handful of times a year. That may be all they see of you, but you want to be able to build those relationships so people can come and say, Michael, like, what's the deal with this? And actually, a lot of the time, you have the conversation and you both come away more informed. So I remember my last place, one of my desktop engineers said, Michael, can we have a chat about kind of some stuff, and I'm like, yeah, sure, let's do it. And I learned loads about some of the challenges in the team. We were able to go, right, okay, well let's dig into that and kind of sort that out and tweak the operating model. It wasn't an insurmountable challenge, but it was really insightful for me to know and understand about that challenge, because I just assumed that was something that would be fine and dealt with and wasn't a concern. But if he hadn't come to me to tell me about that, we wouldn't have been able to address it for him, and ultimately he'd have continued with that frustration. So yeah, it always feels a little bit I guess they kind of, I've heard it referred to, I think Andy Kinnear refers to it as kind of speaking truth to power, and I think those conversations can always feel uncomfortable when you're in the anxiety state beforehand, when you know you've got a conversation and you're not quite sure how the conversation's going to go.
Yeah. You
always feel a million times better after you've gone and had the awkward conversation, and I think actually within health and care we need to have more awkward conversations about things to really get at where the value is.
Love that. I think there's two things to pick up on there. One was really resonated with me, was around, and you just nailed it in terms of walking the floor, meeting people. Before COVID, that was what everybody had to do, right? You were there in person, and I think, certainly in my experience from a supplier side, the people that I've seen around me, peers that have done really well, it tends to be because they'd already built that network of internal and external stakeholders that they could rely on if they needed to get something done in legal, technical, whatever it may be. That's the difference that makes the difference, isn't it? I think, instead of just being some letters within an email, right? You're a person, and building that relationship, getting face time with people is what really makes the difference when you need each other.
Yeah, absolutely. I think people work with people, and I think just yesterday, somebody had kind of asked me to get involved in something in particular, and I said, right, okay, let's have a Teams call and talk it through. And I kind of went into the conversation with probably not a huge amount of intention to take on a huge amount of additional work.
You came away with all the actions.
But by the end of the call, they'd built the rapport, and they'd gone, okay, well, can you come along to the next one and we'll work it out.
Because you brought some value to the table, right?
And that wasn't necessarily my intention going in, but actually you build that human connection, and that kind of, I understood the need and kind of felt the kind of the challenge that they were trying to address. So
sure.
People work with people, and the less we do in email, probably the better, I would say.
What's next?
It's always a really interesting one. I think certainly the move into working with an integrated care system is a deliberate one. Certainly have aspirations to kind of step into the CDIO realm at a certain point when that's right for me and my family. So no immediate intentions in that respect. Got a lot to do. So really hoping for get a good few years in South East London, and really get delivered what we've set out in the 3-year strategy. And personally, for me, that'll mean both my kids are at school and don't come with quite so many challenges logistically, at least. I'm sure as kids get older, they become a bit more strategically challenging. But yeah, no, the logistical challenge will reduce, and I think hopefully that'll get me to the point where I can then go, right, okay, I can really step in and make make the best of it. I think it's a really big job. Huge respect for people that are kind of are doing those roles, because it's a real commitment.
Michael, you've been a pleasure to have on, a gentleman and very insightful. Thank you.
Thank you. Pleasure.